Since 2006, the Red Cross has supported a change to the FDA's blood donation policy, calling it both medically and scientifically unwarranted. Illinois has one of the lowest HPV vaccination rates in the country, with only 1 in 5 girls getting all 3 doses. The addition of sex ed in kindergarten is generating mixed reviews from CPS parents. State Senator Kwame Raoul's decision to not run for governor leaves current Governor Pat Quinn and former White House Chief of Staff Bill Daley as the primary Democratic contenders. With this ban, Illinois joins 5 other states that prohibit minors from tanning indoors.
So how was your last donation? Everything went okay?
Mm-hmm.
Yeah? Okay.
Yeah, everything's gone fine. I've donated probably like...
In 1985, at the beginning of the AIDS epidemic, the FDA passed a ban on blood donations from any man who has had sex with another man.
There was concern that homosexual men had an increased risk of HIV, and therefore the deferral was put into place at that time. It has remained in place since then, even though there's been a lot of discussion and controversy about whether it's necessary to have a lifetime deferral in the current day and age of testing.
Fausto Furnos is a gay man in Chicago who says he would donate if he was able and thinks the LGBT community would do the same.
So when it comes to blood donation, I think the most important thing we need to look at is science and reality. And I hope that the CDC and the FDA are regularly examining their own policies, because the consequence of not doing so is that means that lives are lost because we don't have an adequate blood supply.
Under a change, I'm sure there would be a lot of people that would be interested in donating. That would be good for the blood supply.
Since 2006, the Red Cross has supported a change to FDA policy, calling it medically and scientifically unwarranted.
It's going to be up to us to put political pressure on the FDA to change that policy.
Strides have been made towards equality in recent years, and advocates hope to add blood donation to the list. In Chicago, this is Mackenzie Allen, Medill Reports.
The law can't control you going outside to tan, so I don't think that there should be a law controlling, who can tan indoors.
Last year, the Chicago City Council voted to ban minors from tanning indoors, and now Governor Quinn has extended that ban statewide.
Before, the law stated that you did have to have parental consent to tan between the ages of 14 and 17. I thought that that was something that was fair. I think that parents should be able to make that decision.
Dr. Irmgard Kohler says that most dermatologists advise against indoor tanning at any age, and she agrees.
But what we really recommend then to get a spray tan. If you want to have a darker appearance, I think that's very satisfying to young people. The earlier you start with the sun damage, of course, the more damage you get. It accumulates.
Amy Simonello brought her children to the beach and is undecided on whether the law oversteps.
I don't know that it's right to tell parents what to do, but I can kind of understand why they would be trying to enforce guidelines at least.
Trent Adu says business here hasn't been heavily impacted by the ban, but that's not the case everywhere.
There are a lot of salons that, around homecoming, around prom, those are big times for them, and they've completely lost all of that business due to the ban on tanning.
Nationally, 32% of girls in the 12th grade tan indoors. In Chicago, this is Mackenzie Allen, Medill Reports.
The Supplemental Nutrition Assistance Program, also known as SNAP, was formerly known as food stamps.
Traditionally, SNAP has been included as part of the Farm Bill, but House Republicans recently voted to have SNAP removed from the bill and cut funding by up to $40 billion.
No one is exactly sure what's going to happen with the Farm Bill and with food stamps.
Should the cuts go into effect, organizations like the Greater Chicago Food Depository could be forced to pick up the slack.
The Food Depository hopes that it doesn't have to ever worry about feeding an upper level, a maximum number of people. We always hope that the number of people that we're feeding in a year will decline because the need is declining. But the reality is, for the past few years, we've seen an uptick.
Today alone, nearly 150,000 pounds of food will be distributed. If cuts are made to federal programs, the need could be even greater.
Unfortunately, many of the people who will be affected by these cuts, SNAP is the only federal and state program they qualify for, and there's already such a strain on our charities and local resources.
The average SNAP recipient receives only $35 a week for food, and in Chicago, Nearly 50% supplement by going to a food pantry.
With the budget cuts, it's going to reduce it down to about $1.40 per person per meal.
Regardless of how steep the cuts are, it looks likely that SNAP recipients will be facing reductions.
It's all about making sure that we are prepared for the future.
In Chicago, this is Mackenzie Allen, Medill Reports.